Hello guys, hello, this is Dr. Ayush over here, MBBS from Medical College Kolkata and currently pursuing DNB Orthopedics from Kokilaben Dhirubhai Ambani Hospitals, Mumbai. So basically in this video, what I'm going to talk about is what made me choose orthopedics as a career, orthopedics as a branch. So starting with my NEET PG 2021, I got a okayish rank, and at that rank I was getting several other branches like ENT, MS, MD in some paraclinicals and all, and also in some clinicals I was getting MD anesthesia and all, and also DNB in other specialties. But I decided to stick to orthopedics. Why? Because this is a branch where I felt most inclined to. Talking about the branch itself and my choice, I had a slight inclination towards surgical things because I was a kind of person who wanted to do something from the hands. Okay, in medicine it's mostly about I'm not generalizing thing, but in medicine and in medical branches it's mostly about you see the patient, you diagnose the patient with your clinical acumen and also from some investigations and all, and finally you give some medications and all, and that's how medicine works. But in surgical branches, it's more of a thing where you open up the patient, you exactly reach the pathology, and then you operate, and then the results come. So I was a kind of person who wanted to do some things with the hand, and therefore I chose orthopedics as a branch. But this was not the sole reason why I chose orthopedic surgery, because I could have chosen general surgery or MSc or any other branch. But I stick to orthopedics because what I feel is that this is completely totally my perspective towards medicine and surgery, is that when we see patients coming on stretchers and on wheelchairs, and most of the times, I mean at least 90% of the times, we see those same patients going out of the hospitals on their feet. It's an unparalleled satisfaction which you get as a doctor. So this was the reason I chose orthopedics as a branch, and it's a good branch. Definitely. Career wise, you get rewarded good. You will never be on a dearth of money. You will have good amount of money. If you are even an average orthopedic surgeon, you'll earn good. It is also a branch where you will get both OPD as well as OT things. Like OPD, you'll get patients on the OPD basis. There will be patients for back pain, there will be patients for knee pain, there will be patients for several other things. And at the same time, you will get to operate on patients on whom your conservative treatment will not suffice. So you get both the exposures over here, and both in great quantity. It's not that it's more of a thing where you get to do only one thing. It's a variety of aspects are here. And talking about other things post MS or DNB, here in orthopedics you have a lot of fellowships. You can sub-specialize in spine, you can sub-specialize in arthroscopy, you can sub-specialize in joint replacement, you can sub-specialize in pediatric orthopedics, you can sub-specialize in foot and ankle. So there are a variety of opportunities out there in orthopedics, and therefore I feel orthopedics was a good branch for me. It has just been 18-19 days since I joined Kokilaben Dhirubhai Ambani Hospitals, and exposure here is really good. I get to see a number of cases. Here we have different subspecialties of doctors. We have around 8 consultants in orthopedics. Each one of them has their own subspecialty, so it's a good exposure. Also trauma cases are here in good number. So it's hectic, it's super hectic. It's like a alternate day on call duty, so it's super hectic. I rarely get time to do anything else apart from my residency work. So it's good. I'll hope more and more of MBBS guys, after doing MBBS, they choose orthopedic surgeries. Also, it's really interesting branch because here you get to deal with these bones, and then these implants, nails, screws, plates. There are a number of things over here, and it's more of a carpentry thing also, where you get to join the bones and with all your skills. So it's a really good branch, and I hope many of you will love this branch once you join this, and it's a good rewarding branch. And that's all what I can say about orthopedics. I'll meet in next videos where I will discuss about what are the other aspects in orthopedics and how has been my residency in these days, and how I'm expecting forward what will be like my residency in future. We'll discuss everything. Just stay tuned to this channel. Bye bye.